This video demonstrates the ultrasound methodology of lymph node assessment of the axillary region. The patient lies in a supine position, with the arm abducted and externally rotated. The proper probe placement is shown. We start at the base of the axillary pyramid in the transverse view, positioning the probe at the caudal and lateral edge of the pectoralis major muscle. The probe is moved cranially until it reaches the axillary vessels that are visible running below the muscular plane in transverse section. The two vessels can be followed under the muscles, appearing like a surfer riding under a wave. The surfer sign marks the intersection between the first and second lymph node levels. We can now access and scan the first level of lymph nodes. The proper probe placement and movements are shown. First, the anterior group is visualized. Then, rotating the probe parallel to the anterior fold of the axilla, the posterior group is examined. Finally, the lateral group is examined. The probe is then positioned on the pectoralis major and minor muscles in order to assess the second level of lymph nodes, which are located below the pectoralis minor muscle. The probe is tilted slightly adjacent to the axillary vessels to identify any pathological lymph node. Finally, the third level is assessed with the same method, with the probe medial to the pectoralis minor muscle. The respective ultrasound clips are now shown. To visualize and evaluate the first level of lymph nodes, the probe is moved to the lateral edge of the pectoralis minor muscle. In this case, a few normal lymph nodes are observed. Returning to the pectoralis minor muscle and placing the probe along the longitudinal axis of the vessels, we move across them cranially and caudally, scanning the second level. Finally, moving further medially along the vessels and coming over the medial border of the pectoralis minor muscle, the small space represented by the third level can be assessed. This approach allows the systematic evaluation of the three lymph node levels. The assessment will now be shown again in the reverse order.